I'm going to be demonstrating an intraoral exam on my typodont here. So I'm first going to make sure that my patient doesn't have any lipstick or any dentures or partials in their mouth. I'll then do a visual inspection of the lips, the vermilion border, and the commissures. Next, I'm going to do a general examination of the oral cavity and the mucosal surfaces. So just checking along the buccal mucosa. I'm looking for any abnormalities, lesions, and I'll ask to see if my patient is feeling any tenderness or swelling, soreness. So then I will check out the underlying structures. I'm going to have my thumbs on the outside, my index fingers on the inside. Just look, everything going on under here. Making sure to lift it up to be able to see real well. I'll then palpate the lips, so light pressure. And then for the buccal, the cheek, palpate this way. Okay, and then next I'm going to look at the floor of the mouth. So my patient would lift their tongue for me. Go ahead and lift this up, and I'm just going to inspect underneath the tongue, and I'm going to palpate for any soreness. Check both sides. Okay, and then I will next move on to the salivary glands. So I'm going to use a Q-tip and start with the parotid gland. Just going to be about here, opposite of the first and second molars. So palpate that with my Q-tip, and then under the tongue we have the submandibular glands. So palpate with the Q-tip here towards the back of the jaw. And then sublingual is going to be more anterior of the floor of the mouth. Okay, and then I'm going to inspect the tongue. So I'll have a 2x2 gauze, lift the tongue, and I'm going to check the ventral surface. So check the lateral sides of the tongue, underneath, make sure everything is good. And then the dorsal surface. And then I'm going to palpate the tongue. Checking for any abnormalities. Next, I'm going to inspect the palate with my mirror. The hard palate, the soft palate. I'll palpate the hard palate. Inspect the tonsils, any discoloration, abnormalities, and the oropharynx. And that is my intraoral examination.